what happened 20 years after I left academia? Look like that we have made some progress on study of Asian Americans, and the study on the subpopulation of Asian Americans is very limited. That the enhanced survey, our samples of Asian Americans, including Indian Americans. Unfortunately, that we cannot do a subpopulation comparison among Asian Americans. And the data have shown that, as you can see from this slide, the risk factors of cardiovascular disease and also access to care, including, for example, the health insurance rate, the huge variations among Asian American subpopulations. And this is the slides during kind of back 2 or 3 decades ago. And at that time, when I look at the literature, like there's some quite a bit of studies compares, for example, the Indians, Malays, and Chinese live in Singapore, and a few studies in the UK by comparing Indians live in India and elsewhere, like Caribbean islands and also the UK. So the magnitude is pretty high, as you can see. That was published in the 1990s. I think the study that was done in the 1980s. And this slide shows the difference in lipids among Asian population. I think it's found mainly not in the United States, so still that in Asians live in Asian countries. So I think I'm going to skip very quickly or talk about the NHBI strategic revision because in the interest of time. And every kind of decades, each of the institute at NIH, including NHBI, have gone through the strategic visioning process. This one now is almost a decade old, and the goals of visioning for the NHBI is to understand human biology and reduce human disease, advance technology translation and translation research, also develop a workforce and the resources. That translates to 8 objectives, strategic objectives for the institute, and I highlighted one, the objective number 3. It's about population differences. So this is highly relevant to the topic we are discussing at this conference. And to this audience, I think that not needed to mention about stagnation in mortality and the mobility in the United States, also the enduring disparities among different race and ethnic groups. Unfortunately, the data again that for Asian American overall and subpopulation are very limited. So in the division of the cardiovascular health, we try to implement a strategic vision for the institute, mainly in the 3 areas: turn the discovery into cardiovascular health and reignite the decline of cardiovascular mortality, and also close the cardiovascular equity gap. We're using the populomic approach to drive the NHBI mission, and again, that I'm not going to get into the detail. And we also apply populomics in NIH, and the tools include that the TopMed platform and also the BiData Catalyst platform for data sharing. And TopMed means omic studies of precision medicine, and we're also working with the Environment Health Institute to look at the gene-environment interaction. We talk about the implementation of the strategic vision in a little bit detail here, and we set up 6 groups how to advance the mission of the institute, and that was that article you can see that published in Circulation Research about 5 years ago, and we just submitted kind of update the progress made, and it has been accepted by Circulation Research. We don't know when it's going to be published, but I think the 6 topic area, as you can see here, and one area is addressing social determinant of health, so cardiovascular disease, cardiovascular health, and also health equity. I think this is, again, that relevant to what we are discussing here at this conference. And at the epidemiology branch I lead, and as many of you may know, that we manage and support about a dozen cohort studies, and many of the cohort studies you're familiar with. You may be also participating in the research. And as you can see from here, we'll talk about different populations and study participants with different race and ethnic backgrounds. We include white, African American, Hispanic for the SOUL study, for example. And the MESA study is only one really, including Asian Americans, and unfortunately only mainly Chinese Americans. And this slide shows basically the race and also gender kind of composition of the study participants. If you look at that, I think we have a good representation of Asian African Americans and Hispanic population. Asian American 2%, it's much lower than the 7% of the US population. So we have a lot of work to do on that, and I mentioned TopMed earlier, the transomic studies for population medicine, and again, we include data from different race and ethnic groups, not just the United States and also around the world. But the Asian American is not EA. EA means European Americans, so ASA, Asian Americans. And as you can see that for the different omics, the percentage is pretty low, since this is not just about Asian American, include all Asians. So that's the status, current status on this genomic studies of Asians. And what we usually do, like, for the strategic planning and our priority in major initiatives. And I think a workshop is a good start. And this is a workshop was held a decade ago in the publication at JACC, Journal of American Cardiology. And think at least one of you in the audience, and Lhasa, I think, is also. And but at that time, unfortunately, was not able to translate into any major initiative or even the notice of special interest. And this is more recently, and after I joined NHBI 2.5 years ago, we had a successful conference. Thank you, Dr. Aka Naya, for co-chairing that workshop, and also Lhasa Patton was there as well. And so this, you can see the summary of the workshop from our NHBI website. And the full report will publish at the Annals of Internal Medicine. When was that? I think in January, early this month, January 2022. And I think on my outline, I mentioned that R1 notice of special interest and major initiative. So I think the workshop really identifies the need and research gap for Asian Americans. And this is a study based Masala just showed that the R1 mechanism, R1, of course, as you all know, that we can investigate initiative applications, and so this is just examples we were able to support. And after the workshop I mentioned earlier, and we were able to release a NOCI trying to call the attention to the investigator community, the need of more studies for the health of Asian American, Native Hawaiian Pacific Islanders. And you know that we don't have a set side budget for NOCI, but that may help to the peer review process. Also that any application that has not really not in the payline and the possibilities be selected through the selective process within the by the project officers and also NHBI leadership. So we got quite a few questions, but we have not seen any formal applications yet. But I think this is one step forward. And to me, it's exciting that we were able to put some money aside to nearly set up Asian American and Native Hawaiian Pacific Islander cohort studies and two RFAs, companion RFAs were released in July. One is for the field center, the other is for the coordinating center, and we also had technical assistant webinar a little bit of a month ago, and we put the slides there, but the video and also the transcript, unfortunately there's some technical issues, and we are almost done, and it will be posted soon, but you at least have the slide, and also you can see the frequently asked questions on the website, the link for the IFAs and the FAQs you can see from this slide. And this basically shows the application deadline for the initiative, and it was open actually a couple of days ago, 3 days ago, and the data intent is due on that day, but it's not required. So I encourage you to apply, and the deadline that is October the 13th. And we are anticipating the start date in July of 2023, this next year. Yeah, I tried to be very quick because of the time we lost due to the technical difficulties. Apologies again about that, and happy to take any questions now if we have time, or during the, I don't know, during the panel discussion session. But I would turn that back to the organizer.